We're rolling? All right, we're rolling. We're here at the ENT clinic with Dr. Swerdlin, ENT Family Clinic. And there he is. And we thought since Stino is new on the radio, we better get her nose inspected. So Dr. Swerdlin does all that kind of stuff. And we want to see the inside of Stino's nose. It's according to Stino, it's a train wreck, right?
Yeah.
Right?
Yeah.
So what is that? Have you had problems? Let's get right over here. Have you had problems with it? You've seen Dr. Swerdlin before.
I have. He took like a picture of my whole skull, and I got to see like all the structure.
We have it back there. We might be able to
They actually have it up on the wall.
Yeah, for this is what you don't want.
Do this. Don't do this. So why did we look at? Were you having snoring problems, or were you having pain, or what were you having before?
Well, I always have like bad allergies and
right.
stuff related to that. So we need to see what's going on
you
up
have
there.
Snoring.
And I do snore, yeah.
Snoring, sinus issues, allergies. Any of that kind of stuff, you see Dr. Swerdlin, and he can take care of that for you. So we're going to look at Stino's nose today. Let's get inside Stino's nose.
Great.
Here. And doctor, kind of explain what goes on here.
Yes. So it's painless, by the way. We've done this before.
There's just a huge needle.
That's a camera. It's not a needle. I think it's really cool.
It's a little camera, but it doesn't really hurt.
Yeah.
And you see and we're able to make a video to look inside and show you what's going on.
Oh, great.
Okay, let me.
I can tell you right now, I have boogers in my nose. I can feel them.
So if you bring your nose, if you bring your
it's like when you go to the dentist, you brush your teeth before you go. You're supposed to blow your nose before you come to the
No, it didn't happen. I didn't know
We're going in here. Now look back here. Look back here. This is the inside of Stino's nose. Now what are we looking at?
There's no room, and
it's very tight. Yeah?
It's very tight. There's absolutely no room on the right side of the nose. So there's no room.
There's
so
nothing
she has what we call a deviated septum.
Okay.
And that's a very easy thing to fix and then also it's a little narrow in the front on the other side.
Trim those nose hairs a little too, right?
Seriously.
So this is the other side. The other side's not as narrow as that one though.
So you can see that there's a little bit more room on this side.
Yeah.
And the structure that you see right there is called the inferior turbinate. That one is called the middle turbinate. So you can see that there's more room on the left when you go to the back, but in the front it's a little narrow still. You see that?
Yeah. So in the front, one side is narrow, and in the back, it's the inside that's narrow. On the other side,
so this is narrow in the front, but once you get past that,
it's okay.
It's open.
Oh.
Sorry.
And this side is wider in the front, but narrow in the back.
Yes.
Are most people that way? Do they have a narrow side and a wider side?
Yes, but not as bad.
Not as bad as Stino's.
Stino's.
Now, is that what would cause like snoring in her? Or?
Yes, if you cannot breathe. Actually, let's take a look in your mouth. Is it okay? Well, we don't have to look in your mouth.
Yeah, I don't care.
Well, so let's take a look in your mouth.
Now we're gonna go inside Stino's mouth.
I got one silver tooth back there.
Well, we're not looking at the teeth.
I know.
So
we're going in the mouth. Here's Stino's mouth.
Say and now it's gonna be even better because we're gonna look down in your throat. It doesn't hurt. You don't.
No, I know.
You're gonna say.
Yeah, no pain or discomfort so far.
Nothing.
Right?
And basically, you're gonna say with your mouth open.
Okay.
While we do this, and that's a way to look at the vocal cords, to make sure that there's, like people that have smoke, make sure they don't have polyps, nodules, cancer, stuff like that.
All right. Is it important to get that inspected once in a while, your throat like that?
If you're a smoker, probably. If you're hoarse.
Okay.
So open your mouth wide. Actually, I'm going to make a recording too. And we've done this before. So lift up your head, stick your tongue out as far as you can. I'm going to hold your tongue, okay? Just like that. And you can make the video of
Stino's tongue.
There's
Stino's uvula.
Say ee.
What's the vocal cords or what? Is that down there?
Say ee. Beautiful.
There you go.
So I'll show you your video.
Yeah.
Spin around, take a look at it.
Did it hurt? It didn't hurt, right?
No.
I haven't hurt you so far.
I didn't feel it at all.
I haven't hurt you so far.
No.
Excellent. So we took 2 videos.
I can barely say E as it is.
I know it's hard because I'm pulling on your tongue. So we start with the nose one.
Oh, great.
I need to make sure. So this one is going to be your throat. So what we're looking at, this is the tongue, this is the uvula, this is where the tonsils are. People that snore have a very large uvula, very narrow airway. The tongue sometimes it's high and falls back, especially if you sleep on your back. These are the tonsils, But we wanted to go a little farther in to see your money maker, your voice box, right?
Vocal cords, all right.
Vocal cords. And this is the entrance to the windpipe. We have a nice picture of your vocal cords a little bit later, I think. Let me see. but they look fine. So you can kind of see them for a fraction of a second.
Yeah, I saw that.
It's back there.
Oh yeah, those two things.
But they look good.
You're good. Good vocal cords.
Good vocal.
Yeah, they
there
are.
you go.
Nice.
Yeah. All right.
So it looks good. So the vocal cords look good. So no polyps, no nodules, nothing like that.
Well, that's good to know.
And then the nose, this is what we were talking about how you have the deviated septum. So
this is a side that's wide on the outside but narrow on the inside.
You're great.
Yeah,
You figured it out.
But she has she's wide on one side and narrow on the other.
Yes.
But both are
bad.
Right.
Because this one is wide at the very beginning is
Sorry, I'm
wide.
always blowing my nose and stuff because
And
one
then there's
side
no
always
room.
feels like it's clogged.
Yeah.
There's absolutely no room. This is the center wall, the side wall, no room whatsoever
So breathe.
on your right
Yeah,
side.
yeah.
But that's but the very entrance is open, but then it closes right away. And then there's no way to go. So this is a deviated septum. Very easy.
So what's the other side?
You'll see the other side. And then the other side, it's way more open once you get in. The problem is the very beginning, which you'll see here. I think I did it here. Okay.
She's got a carpeted floor in her
So you
nose.
see that? So that's
Yeah.
the front of your other side.
Yeah.
So the
that's
cartilage-
narrow here.
Yeah. The
Yeah.
cartilage in the very front is
Yeah.
it's blocking this nostril, and then it goes that way and it blocks the other side.
Well, you want to have nose hairs so they stop.
Right. It's like a little filter deal.
So you can see how you have more room. Once I get through that
wide
narrowing,
open back there.
Yeah.
You got a truck through there.
small semi.
Yeah. Small
Yeah.
But definitely there's more room. Maybe the beginning of a tiny little polyp, probably from the allergies that we.
So, do a lot of people have where the front is wide on one side and narrow in the back, and then
Yes.
opposite narrow in the front and wide? Do a lot of people have that?
Yes, it's pretty common. And what happens is the septum. I'll show you a picture here that we have of the septum. So this is the center wall that we're talking about.
Yeah.
Called the septum. And these are the turbinates, which are on the sides, right?
Okay.
So there's cartilage, and in your case, it's kind of
Bowed out?
It's bowed out. There's a little bowing, so it goes like, I guess it goes like this.
Yeah.
So it's narrow on the left side, and then it's narrow in the right
Is
side.
that normal? Do most people have it where it bows one way or the other? Or?
Not everybody,
No.
but the thing is
Yeah.
that for me it's cute because most of the people that I see have nasal problems, so
Yeah.
I seem to
Oh,
think
you
that
think everybody's screwed up?
everybody has a nasal
Yeah,
problem.
yeah.
Yeah. It's
Well, I
like being a
only
police officer. You see everybody on their worst day. You're pulling people over to give them a ticket. It's not like they're gonna. Yeah,
That's
yeah.
right.
You have people when they have nose problems. They
That's
come
right.
see you.
They come to for me.
Yeah.
Everybody that I see has a nasal problem,
Yeah.
but then I fix them, and then they don't have a
And
nasal.
they're
Yeah.
fine. So, and we talk about there's minimally invasive options.
Yes.
She could come in and you could fix that, and
Yes.
it would be
You
not
can
a.
do that in the office, very easy. Very minimal discomfort. You're asleep, you don't feel anything. We use special gels that numb the nose very nicely, but you'll be asleep. We can also use laughing gas if you don't want to be
Oh,
completely.
I like that.
Use that.
If you-
Yeah.
Yeah, we
Yeah.
have it in the other. We have it in the other
I don't
room.
even
We
need a
don't use that
procedure.
now?
Yeah.
We have it in the other. You can use it in the studio. So if you're
Yeah,
not
yeah.
laughing.
Yeah, that's what I was thinking.
Actually, I'd like to get it to all our listeners so it would really help with the show.
Or if you can transmit that through the radio waves.
Yeah.
then-
Yeah, there you go. Yeah. So
You
that's
talk like this.
so that's kind of thing when people come in to see you, you sit down, you look at like you just
Yes.
did, you do the ear and the nose and the throat,
That's right.
and then there's different ways for you to attack.
We also do an
the-
allergy test, and we also do. And
Yeah,
I
I'm
think
allergic to a lot
And
of
we did an
stuff.
allergy test. Let me see. Do we have? Hi. Can you ask them to bring me one of the allergy things? And we did it last time, and you have
Yeah,
allergy.
we can do it.
When I was a kid, like
definitely do.
allergy tests were horrible. It was a nightmare to get an
It's
allergy
so
test.
easy
It was a-
now. So
but
easy.
Emily had her kids in, and she said she was surprised by it wasn't horrible.
Yeah,
Like,
it's a
it was-
piece of cake. And we'll show you. We'll show you how
Yeah,
we do it.
I'm allergic to cats. I already know that, and
That's right.
almonds. So
and
Yes.
almonds.
yeah.
Yeah.
And then almonds that goes into peaches because they're in the same group and stuff. And
Wow.
but I know that cats and almonds.
So
are
if you
for
had a
sure.
cat eating almonds and peaches, you would not be good.
Right.
Yeah.
Right. Yeah.
That would be a good circus skit. So
Now you
if,
know how to kill me.
if people come in and see you like for an initial consultation like that, how long does that take?
It
And is
doesn't
it
take very
expensive?
long.
And
It doesn't take very long. As I said, we take a look in the nose. Sometimes we take a look in the throat.
Yeah.
We do the little allergy test, which is a little plastic brushing. They're trying to get me one to show you. I don't need that. I need the actual plastic Well, this is what I need one empty. Thanks. So we do that, and we do an X-ray, and we did an X-ray on you.
Yeah.
Which we have it there. We can pull it out and we can show you.
It's a matter of coming in and getting it fixed.
It's crazy, the nose that they show, like a picture of a regular nose and then my nose, and it's like...
Well, now you got a job and you got insurance, it's time to get it fixed, right?
Yes.
Yeah, so, and I know you take our insurance, you take pretty much...
Yes, we take, and we see people with and without insurance.
Without insurance.
The fact that we can do this in the office is great. It's very, very safe.
So even without insurance, it's not going to bankrupt them.
Yes.
No, it's
and all my patients get my cell numbers. If there are any issues, any problems, when you call me, you have a
call
direct.
you.
Yes, me. You get me.
Wow.
And we can FaceTime also.
Great.
So patients have done for a procedure, and we do FaceTime if they think they're having an issue or a problem. Did you bring it? This is come Essie, come. This is Esmeralda. She's one of my amazing medical assistants. So this is what it looks like, the allergy test.
Oh yeah.
And we just soak it in whatever we soak it.
Yeah,
and then we just do this, and it doesn't hurt. So you do that, and then you wait 15 minutes, and if you're allergic, you get a little bit of a bump.
Yeah.
And we can treat that with drops as opposed to shots.
Okay.
Shots you have to go once a week.
As a kid, I had to get shots.
You gotta get shots. So this is drops. You do them at home. They're very effective. They're very, very safe. So that's another thing that we can do. We also do home sleep tests. People that have sleep apnea, we're worried about.
I've done that before. You put the device on, you go to sleep, and it tells you how.
We give them. It looks like a lunchbox that you take it home. It's a little strap in your chest. Very easy. Do we have a sleep test machine, Essie?
Yeah, doctor.
Yeah, can you bring me a sleep test machine?
Yeah.
Here, so in here and get a little closer.
Yeah,
so get in the background.
So that's another great thing that we can do. We can send a patient home with a home sleep test machine, as opposed to having to go to a facility and spend the night there.
Which I don't know if I could even fall asleep there.
People can't fall asleep. They lay you down, they fill you up with wires, and they say, okay, don't fall asleep now.
I don't think I'd be able to.
You can't fall asleep. Well, this one you take home, and so we get the results right away.
Very cool.
We're getting a lot of patients that are truck drivers. They're worried about getting their commercial driver's license, and the commercial driver's license requires them to get a sleep test. So they come here, they get it here, and the ones
I didn't know that was required.
And the ones that have the sleep apnea, we can fix it in. We have all the options available to help.
So it's not like sleep apnea. Usually they slap a CPAP on a person, and that's it. But if you're not interested in that, there's less than cumbersome ways to fix the sleep apnea, right?
So we found out how bad it is. We found out if the nose is part of the sleep apnea. If you can breathe through your nose, you're more likely to have sleep apnea. We look at the throat like we did, at the tonsils, and now we can shrink tonsils. It's not as bad as what it used to be. We can modify the soft palate, and there's mouthpieces that you can use also instead of having the big CPAP. Well, we have all the options available, and the most important thing is to know whether or not you have it, how bad it is, and what can you do to get rid of it, because it's a health hazard.
Yeah.
We do have. Can we go to the city? Okay, so this is our sleep machine.
This is the test.
This is the sleep
They
test.
take it home and they.
Super easy, There's a little strap. So this basically you strap it around your chest.
Yeah.
And there's a little. This goes to your finger to measure your oxygen.
Okay.
So you just put it in your finger, and there's another thing that goes into your nose, like a little nasal cannula. So very comfortable. So you go to sleep with it, you press the button, and then when you bring it back to me, it's going to tell me if you have sleep apnea or not, how low your oxygen dropped, what happens to your heart rate. Some people that have sleep apnea, their heart rate goes crazy,
Yeah. Well, that kills people.
Exactly.
Yeah.
So you're able to diagnose a lot of things, very simple, very easy, and it's very affordable too. It's not going to a facility for a sleep test is very, very, very.
You gotta pay people to watch you sleep.
Yes, very expensive.
All right.
And then if you want, do you want to go look at, can we look at your CAT scan?
Yeah, of course.
Let's go there.
Okay.
Let's do it.
So we talked about insurance.
This is Belle. Belle is my marketing.
Hi, Belle.
And that's my director of operations, Jennifer.
There you go.
Hi.
She keeps me out of trouble.
There you go.
Full-time job.
So we talked about insurance. You accept most insurance.
Yeah.
A lot of times people don't have insurance. You can work out where they can still get something.
Yes. We see patients with and without insurance.
Okay.
So this is where we have the CAT scan. We have Tavi here.
Hi.
My other medical assistant. And this is Drew, who is my physician, one of my physician assistants.
What's that?
I have three physician assistants. So let's find her CAT scan. This is where we did the CT scan. Very, 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 very low radiation. It's like a dental X-ray. It's a little bit of a mess, but we're going to close it.
All right.
But yeah, this is where we do the CAT scan. So you sit down and you don't have to go to a facility. Very, very low radiation. And the other thing about this CAT scan is it generates a GPS map. So when we do the procedure, the balloon to open the sinuses, we have a GPS. We know exactly where we are, so it prevents brain injury, eye injury, stuff like that.
So you know how it's going to look when you go in before
exactly.
you go
in. And as we're operating, we know exactly where we're going. So you can see it. This is
Stino's?
This is Stino's CT, okay?
All right. I'm looking for a brain. I'm not seeing anything. I'm not seeing a darn thing.
So this is the septum. This is looking from above. Okay?
Oh wow! Look at
There's
that.
no room. Black is air.
Yeah.
So you have absolutely no room on this.
But what if I fixed my nose? Would that change my voice?
No.
I'm curious
Because
about
your voice
that.
is your trademark.
Yeah, yeah.
And as you go back, this is your right eye.
Yeah.
That's the left eye. This is where the sinuses are. And then as you go back, you can see that there's no room on the right side. And you actually have fluid in your sinuses. The sinuses are below the eyes.
Yeah, this was taken, when was that? In 2019.
Yeah, we saw you in 2019. So very deviated septum, fluid in the sinuses. You were having sinus pressure. And
Yeah.
headaches at the
Time to get it fixed. So, and it'll improve not just, you know, how it looks and all this, but
it's
quality
great.
of life.
Yeah.
Like
Look
she'll
at
be
that.
surprised, like breathing, how much easier it is to
Oh,
breathe.
you're gonna be able to sleep better, breathe
Yeah.
better. You're not going to.
The black it's supposed
Air.
to be equal on both
Yeah,
sides.
you can see how
Yeah.
it moves like that.
Not so much.
So it's and then we have something kind of, we can do a 3-dimensional mapping of your face. So this looks almost like a cartoon.
I think I want to get and put up on the wall.
So you see that's-
okay, that's just creepy.
That's Stino.
That is creepy.
Yeah, you can go solid. That's Stino without eyebrows and without. And then we can show you for Halloween. You know, this is.
Okay.
Yeah.
Wow.
How,
Wow. The skull of Stino.
But yeah, so these are the things that we can.
Very
do.
cool.
Not everybody needs to be put to sleep. We can do it laughing. Sometimes, for Stino, you know, you do have a deviated septum, so you
Yeah.
need to. But it's not that. It used to be that. But with the new technology, it's very easy.
easy to
We
fix.
don't put any packing. We put a gel in the nose after the
Yeah,
procedure.
my brother had to have all that.
The packing is a pain
Yeah.
because they're pulling.
Pull all of it out. Yeah.
So we put a gel and the gel dissolves. So
Wow.
it's not.
So if she got that fixed, like, would she be off work for a week or
3 days.
3 days?
Yeah.
So if she did it on a Friday, she could come to work on
Monday or
Tuesday.
Tuesday.
Yeah.
I'm gonna do it on Monday.
I know. I know. So if you have questions or you want to come in and get a consultation, you will talk to people.
Absolutely.
You'll do the camera stuff and all of that
Yes.
before you have to worry about any of the other stuff. And there are
Yes.
different options for everything, whether it's sinuses or ears or nose or throat
Exactly.
or allergies. There's so many different options. The best thing is probably come to talk to you about it, right?
Yes.
All right.
Absolutely.
All right. And so make an appointment. Go on the website to make an
You
appointment.
can go in the website to make an appointment, or you can call us. You know. But yeah, we'll get you right in.
All right.
Now we have an office in Mount Prospect also.
Okay. Yeah, it's Kenosha, Mount Pleasant,
Mount Prospect,
Mount Prospect,
in Illinois.
Yeah.
and Oak Creek.
And Oak Creek. I was thinking of Wisconsin. Oak Creek, Kenosha, and Mount Prospect are the 3 locations. And you can check out the website. Was it sinusandsnoringmd.com?
SinusandSnoringMD.com.
Yeah, yeah. And it's worth just to get a camera shot of the
It
inside
is.
of
That
your
was
nose,
pretty
right?
awesome.
Yeah. And then to come in, I'm still working on world record earwax. We'll have to do that next time.
Yes. Yes.
Yeah.
I'm gonna break the world record. I'm getting in Guinness, and it's gonna be for earwax.
You're working hard.
Yeah,
I know.
I am every day. I don't know how, but I'm working on my earwax. Dr. Swerdlin at the ENT clinic, ENT Family Clinic, and the website is.
SinusandSnoringMD.com.
Check them out
Sinus
online,
and
and then
Thank
come
you.
in and
Thank you. Great seeing
maybe
you.
your face will look as terrifying as Stino's on the inside. All right, check them out online. Thanks, Dr. Swerdlin.
Thank
you.
you.
Great seeing you.
Good seeing you.
Great seeing
Good
you.
seeing you.
Thanks for coming.
Yep.